Hey Oklahoma, welcome back. Improving health and safety. Employers across the state learning about a new program called Work at Health. The Oklahoma State Department of Health leading the charge here. And in studio, one of the program trainers, Karen Leimbach. Thank you so much for being here.
Yeah, thanks for having me.
So let's start with the first question. What is the goal of Work at Health?
The goal of Work at Health is to provide employers a resource to really help their employees. We know that employees spend about 1/3 of their waking hours at work. So employers can really influence the health. And we know that as a state and as a country, health is very important. Oklahoma, we consistently rank lower. So we're just asking employers to help us create healthier environments so that their employees have the option to make healthy choices at work.
And what's the program look like in terms of practice? What are you teaching employers that they can, teach their employees?
Yeah, one thing I love about Work at Health is we've had the opportunity to work with people that have been doing employee wellness for years, and then people who they've never done it before. It's just another duty assigned to them, right? So Work at Health is 5 weeks long, and it's a mix of virtual and in-person training. And over those 5 weeks, we take them through 8 core elements to create an employee wellness program. So they're going to learn about how to talk to their leadership about why employee wellness is important and the impact it can have on the company. They're going to learn how to do assessments, identify what the employees want and what they need to improve their health, how to communicate that, and really how to implement a program and then evaluate it as well.
And you have some employers, a part of the current cohort right now. How's it been with them and getting them, on the road to health and wellness here?
Yeah, we just wrapped up last week. Our last cohort, we had a trainer who's going to be certified here in a couple weeks, Amber Browning with Norman Regional Hospital. She did an incredible job. She actually had a cohort that was really fun. It included a mix of healthcare systems and public health facilities, and it had a mix of people that, they started employee wellness before COVID, and then COVID hit and it was all hands on deck. So now they're trying to get back into the rhythm and just trying to find out resources to help them. And then you had people that were 6 months on the job, and this was the first time they've been asked to do employee wellness. And I can say by the end of our in-person day training, all of them felt so empowered. They felt confident. They were ready to take back the tools and resources that they learned and start implementing it at their work site.
And there are health benefits to having a workplace that puts an emphasis and importance on health and wellness in the workplace, right?
Absolutely. So we know that leadership likes to talk about return on investment, and that can take several years. But employees can start doing challenges. So you can start seeing employees increase physical activity, maybe increase their water. We have a hydration challenge going on right now at the Oklahoma State Department of Health. It's hot and we need to make sure we're staying hydrated. You can also do evaluations from year to year and start to see a difference of what employees are reporting their health status looks like. You can get them involved in a diabetes prevention program. So maybe they're pre-diabetic, but after that program, they're no longer at risk for that.
Okay, and talk about just why these programs are so important for employers, employees, and just the general state of health and wellness there and safety in the school, in the work building.
Yeah, absolutely. So, us at the Oklahoma State Department of Health, we really are focusing on leading Oklahomans to prosperity through health. And one way we do that is making sure that everyone has the choice to make healthier decisions. And when you put an emphasis on employee wellness, you tell employees that you care. You care about their well-being, you care about their family well-being, you have insurance benefits for them, but you're going to step beyond that by providing additional benefits. So you're creating loyalty with your employees, which employers want. We want people to stay with us longer. You have less people being absent. You see less rates of presenteeism. So employees are showing up to work and they're actually working. They're giving 100% because they feel good and they want to be there.
All important pillars, know, so for an employer that's watching this and they say, okay, we want to get in touch with you all, we need a trainer, how can they get involved with Work at Health?
Yeah, they can go to our website on the Oklahoma State Department of Health, and my information is there if they want to email me. We also have local trainers because we think it's important for you to be connected to local resources. So our local trainers' information's on there if they want to reach out to one of them. And then they can also fill out a form that just lets us know they're interested in the next cohort. We try and do them throughout the year, and if they're interested, we'll reach out and get in contact with them.
Okay, so get in contact with Karen. We're going to have all of that information up on KOCO.com, our Scene On section. Karen, thanks so much for coming in.
Thank you.